I'm Dr. Cynthia Kooima. I went to the University of Michigan for undergrad, and then I went to Michigan State University for my medical school training. And I did my residency in orthopedics at Henry Ford Hospital in Detroit. That was pretty early on. Even when I was a kid, I just loved fixing things. If there's something broke around the house, I'd go find a screwdriver and go fix it. So it was a nice combination for me because I've always been active in sports. So to be part of sports and fixing things, orthopedics was a perfect fit. Actually, I decided that for my sports fellowship year, I wanted to get out of Michigan. I'd always lived there my whole life and see a different part of the country. So I did a fellowship here in Phoenix for a year, and I really enjoyed being here. So I went back to Michigan for 2 years and practiced, and then I missed the sunshine and had to come back. I see a wide range of patient ages, from kids with buccal fractures all the way up to older patients that are in the stages of needing joint replacements. A lot of my patients are, active people, whether it's on a high school or club team, all the way up to the recreational athletes and things of that nature. Actually, for a year, I was the team doctor for the roller derby, the Derby Dames, and that was a lot of fun that year. Pretty much everything. I mean, they're really high-performance athletes. You obviously see a lot of bumps and bruises, but there are a lot of knee injuries, arm and shoulder injuries, things of that. They pretty much beat everything up in that sport. One thing is hip arthroscopy. I do a lot of that, which is fixing a lot of problems within the hip joint through small incisions. It's a relatively new area in orthopedics that not as many people have training in. Another one that's a little more common is I do some of the cartilage transplant. Works for people that have cartilage injuries that are very localized, where you can actually harvest cells, have them grown in the lab, and come back and implant them to fill in that cartilage defect and hopefully prevent them from needing a joint replacement or, earlier in their life than they would have to otherwise. I would say if it's more than just a muscle strain, something that hasn't gotten better, when you've taken some time off, you've taken some ibuprofen, things like that, and it's still bothering you, it's a good time to have a check to make sure it's not something more severe.